Hello, dear viewers, and welcome to a brand new episode of Doc Talks, your weekly guide to understanding the medical and behavioral topics that matter most to you and your family. Now, in today's episode, we're going to talk about peripheral arterial disease, which is one of the common health problems that affects blood flow to the limbs. And as the condition progresses, it may lead to serious complications. Our guest today is Dr. Abdullah Alfawaz, Senior Specialist in Vascular Surgery and Catheterization, to talk with us about the disease, its causes, its complications, and how to prevent it, in addition to the link between diabetic foot and poor circulation. But before that, we'll learn more about our guest, and we'll be right back. Stay tuned. Welcome back, dear viewers, and now we are joined with our distinguished guest in the studio, Dr. Abdullah Alfawaz. Hello, Dr. Abdullah. Thank you for joining us.
Thank you for having me.
Well, to start, what is peripheral arterial disease in simple terms?
So simply put, peripheral arterial disease is disease that affects the arteries that are away from the heart. The arteries are supposed to take blood from the heart to all the organs of the body. And if there is any blockage or narrowing, then we call that peripheral arterial disease. What happens usually, and this is a very common misconception, is the problem usually arises away or downstream from the blockage. So if the blockage, for example, is in the thigh, most people expect to have pain in the thigh or symptoms related to the location of the thigh. But usually what happens is the blood flow is reduced below that.
Yes.
Because no blood flow goes to the leg or the foot, and that's where we see the problems. And then this applies to any artery in the body. So if the artery is supplying your intestines, the symptoms are going to be in the abdomen with abdominal pain. If they're supplying the brain, then the patient might have a stroke or something else.
So could it possibly have a domino effect on other areas of the body?
So the more central the problem, the more likely it's going to affect more organs.
And what are the most common causes of it?
The causes, we have risk factors that lead to blockages and narrowings of the arteries.
Yes.
The most significant ones are smoking and diabetes. So these are the biggest players that cause these problems, and they're the biggest risk factors. Other risk factors are like high cholesterol, high blood pressure, and there are some risk factors that we cannot control. We call them non-modifiable risk factors, like age. So as the person gets older, they're more prone to this problem. And gender, so males are more prone to this than females because their hormones are more protective for peripheral arterial disease. And then obviously you have genetics, so family history plays a big role in these problems.
Hereditary
Correct.
family history. Now, so there's something called the diabetic foot, and how does this problem affect the diabetic foot?
So peripheral arterial disease is part of the problem with diabetic foot. So diabetic foot is a constellation of problems that happen in patients with long-standing diabetes, and they all present in a very similar way, and that's why we group them in one group and call them diabetic foot. So one of the problems is blockages or narrowings in the arteries. The other problems are related to the nerves and nerve endings in the foot. And when you combine the two, the problem is called diabetic foot. So what happens usually is the patient loses sensation in their foot because of the nerve endings that get damaged by the diabetes for a very long period of time. And they also have at the same time blockages of the arteries or peripheral arterial disease, and therefore the circulation is very poor in that area. And with time, because of lack of sensation, they injure themselves. They wear ill-fitting shoes, for example, they're too tight. And then these wounds or these injuries, they do not heal because they don't have enough blood supply to that area.
I see, and you hit something. There's a point you just mentioned. I'd like to circle back on it, which is the footwear. But first, can you tell us, is every diabetic patient at risk of peripheral arterial disease?
The majority are at risk. And that's why we have guidelines that support screening or early testing for these patients. So currently in the Society of Vascular Surgery, which is the biggest vascular surgical society in the world, the recommendations are to screen diabetics at least once in their lifetime. When they hit 50, with a very simple test we call ankle brachial index, which is just to check the blood pressure in the legs.
Ankle breaking
Index.
index.
Yeah. So this is a very simple test. We can talk about it in detail, but it takes 5 minutes, non-painful, no side effects or any complications from the test itself. But it screens for this disease early on, so we have the information and we know that this patient is at risk more than another patient.
So early detection, prevention. Or...
Exactly.
Now, we'll move on to another, or dive into another, we'll shift gears basically. What is the role of smoking and blood pressure and cholesterol in the progression of the disease?
So we mentioned that these are risk factors for the disease. So we know that people who do these things or have these diseases are more likely to develop peripheral arterial disease.
Yes.
And people who stop doing them are more likely to have a slower progression of their disease. So the role is to modify these risk factors by asking the patient to stop smoking and control their blood pressure and cholesterol to improve their outcome in the long term.
How does the poor circulation affect wound healing in the foot?
So as you would imagine, if you have poor circulation, the body is less able to deliver nutrients, less able to deliver the cells that are needed to create new tissues, new skin, fight off infection, all these things that happen to a diabetic patient. So if you have poor circulation, then whether it's an injury that is accidental or whether it's a surgical wound that happened because the patient needs a small procedure in the foot, these all are not going to heal because of the poor circulation that is not able to supply the foot with what it needs to heal.
I see. That's very interesting, Doctor. Now, I'd like to pause there as we have a report and we'll be right back to our conversation. Now, dear viewers, please stay tuned. Let's watch this report together titled The Healing on a Plate. So let's watch it together and we'll be right back. Stay tuned. Welcome back, dear viewers. Once again, we are joined with our in-studio guest, Dr. Abdullah Alfawaz. Now, Dr. Abdullah, we're going to move on to the diagnosis and treatment aspect of this topic. What are the main tests for detecting arterial blockage?
So the most rudimentary and basic test is our hand. So we can just feel the pulse in the patient's foot. If there's a pulse, that usually means that the arteries are intact. So there's not usually a very significant blockage. But given the complexity of the patient conditions that we see and the potential for very serious complications, we usually get more objective tests to kind of confirm our findings and to make sure there's not like something mild that can be improved in the patient's condition. So the first test we talked about, which is an ankle brachial index. And what this means is we check the blood pressure in the arm and we check the blood pressure in the foot near the ankle.
Yes.
And we compare both blood pressures. And this gives us an idea of how much the percentage of blood flow that makes it down to the lower leg and the foot. And this is the most basic test. It takes a few minutes to get done. And then we can follow up with different tests if we do find some abnormality in that first test. The second tests are usually more labor intensive, so it takes more time, more effort by the doctor to get it done, but they give us some more information before we move on to the treatment part. So these tests include ultrasound tests. With these tests we can look at the artery itself, we can see where the blockage, exactly where it is, whether it's just a narrowing or a complete blockage of the artery, and we can determine what percentage of blockages are there in the artery. So if it's just a 50% narrow or 100% blocked, all these things we can tell with the ultrasound. And then the test after that, which is even more accurate and sensitive for detecting these issues and gives us some more information, is a CT scan.
CT scan?
Yeah. CT scan will give us a three-dimensional image of the arteries and exactly where the problem is, and this is especially useful for more complicated interventions or procedures that we need to do.
For the next question, now some people wonder what is the difference between surgical or catheterization and the one you mentioned, which is the balloon or stent angioplasty?
Yeah. So the basic difference between surgery and endovascular intervention or angiography is that surgery, we have to expose the artery that we're treating. So we have to make an incision and basically dissect everything out and see the artery and fix it then and there. And this usually, just like we mentioned, needs general anesthesia, multiple incisions, and a longer healing time or recovery time post-procedure. And the angiography, the minimally invasive ways of treating this is the complete opposite.
Yes.
So it needs basically local anesthesia only. Most of these procedures, when I do them, the patient is awake and I talk to them during the procedure.
Interesting.
Yeah, and they can actually see the images and see the arteries that are blocked on the screen when we're working. And they usually go home the same day or the next day at the most.
Feeling fresh or dozy from the maybe anesthetic or something?
They usually don't need anesthetic.
They don't need it.
It's just local anesthesia.
Local anesthesia.
So it's just local anesthesia where we put the needle just to numb the small area.
And when do we resort to traditional surgery then?
So right now, the first line of treatment is with the minimally invasive techniques. But unfortunately, we cannot treat all the patients with this. We can treat the majority. I'd say maybe more than 90% can be treated with these minimally invasive techniques. But some patients, due to multiple factors, whether they have tried and failed multiple times with the minimally invasive techniques, whether it's an anatomical restraint, so like some places in the body, it's not good to place a stent, for example, around the joint that's very flexible, the stent can break, something like that. And each patient has to have their own tailored therapy that's best for them, depending on all the criteria we look at. So some of these patients, again, less than 10%, will need the traditional surgery. It's still being used and it's here to stay.
Interesting. Now, we did touch on this previously, and I'd like to elaborate. So can you tell us how important is foot care specifically for diabetic patients?
So foot care is very important in a preventive way. So we don't want to reach the stage where we have to do all these complex procedures and arterial procedures and all that. The best way is to prevent it from happening in the first place. So foot care involves checking the foot. Foot care involves wearing the right shoes. So ill-fitting shoes that are very tight or very loose, cause a lot of friction, will lead to wounds and damage and injuries to the foot. That will start this whole cycle of treatment and therapies and complex repairs, basically.
I see. And now, we're shifting gears. How can ulcers and chronic wounds be prevented?
So one of them is foot care. So foot care is very important. The other part is checking the foot periodically by the patient himself, or the relatives, basically. So what we do is we check between the toes, we check at the bottom of the foot, because these patients don't really have sensation, but they might have a big wound or a big ulcer or an infection brewing without them knowing.
Well, doctor, it's all very interesting, and we need to pause there once again, as we do have to take a break and come back to our interview. Dear viewers, please stay tuned. Let's watch this report that everybody has prepared behind the scenes and worked so diligently to bring to you. And after that, you don't want to miss the segment, which is Myth or Fact, where we present a statement to our doctor here in the studio, and he can tell us if it is indeed a fact or a common misconception. Stay tuned for that and much more. Welcome back, dear viewers, and we are still here joined in the studio with our distinguished guest, Dr. Abdullah Alfawaz. Now, doctor, this is one of my favorite segments, which is we're going to present to you a statement, and you can tell us if it's a fact or a common misconception. For the first one, if the pain stops, it means the problem is gone.
That's a major myth. So diabetics usually don't have any pain. So patients with diabetic foot problems usually have numbness around the entire foot, whether it's the bottom or the top. So pain is not usually a part of the presentation unless it's very late in the process where they have infections in the bones and other serious complications.
Now, it's interesting because we just mentioned that during the break. You said you faced some sort of patient that didn't feel it for a few days or something, the toe?
So it's very common for diabetics who walk barefoot
Mm-hmm.
to have this kind of problem. And what happens is they injure themselves, or they have a cut in the bottom of the foot,
Yes.
which they don't know about. Sometimes they find out indirectly because there's some bleeding from it when they're walking,
Mm-hmm.
or sometimes, like we discussed, it can be a few days afterwards when the wound gets infected and the patient doesn't feel well and has a fever and doesn't know why this is happening until somebody checks the foot
Mm-hmm.
and finds this problem.
Okay, so for the next one, wearing tight socks improves blood flow. Myth or fact?
Oh, it's definitely a myth. So tight socks are a major what we call a contraindication. So we cannot do that in patients who have peripheral arterial disease.
Mm-hmm.
So if you can think about it, the blood flow is already weak going down to the foot. If you put more strain on the vessel and compress it from the outside, then the blood is going to be even weaker going down. So patients who have abnormal arteries are not supposed to be wearing anything tight, because it can compromise the blood flow going down to the foot and toes.
I see. And now, a diabetic foot patient can walk barefoot at home safely. Myth or fact?
Yeah, we just mentioned
Mm.
that's a myth. So diabetic patients, especially those who have reduced sensation in the foot, should be wearing some sort of footwear all the time.
Okay, so what about wearing tight shoes? They say wearing tight shoes has nothing to do with arterial blockages.
So tight shoes can cause problems. They don't affect the arteries directly, but they affect patients with diabetes a lot. So patients with diabetes, again, they don't feel pain that well in their foot, so they can be wearing a tight pair of shoes and walking with it for multiple kilometers. This can cause damage to the bones, damage the skin, cause ulcers which can get infected, and you can get into all of this diabetic foot issue all over again.
Okay, myth or fact, exercise is harmful for someone with arterial blockage.
It's a myth. So exercise is useful, although exercise does not open the arteries that are blocked. It is useful indirectly through the overall benefits of the exercise. So exercise helps the heart, for example.
Okay.
If the heart is better, the circulation is better. This can help blood flow reach to places where it's already compromised. But unfortunately, exercise itself, and this is a big myth, does not open the blocked blood vessels. Once they are blocked, they can either be opened by the minimally invasive techniques we talked about or the traditional surgical techniques that are available for a while.
Okay, so speaking of arterial blockages, so myth or fact, it only happens to the elderly.
That's a myth as well. So recently in my clinic, I saw a gentleman in his mid-30s
Okay.
who had severe blockages in both arteries of his thighs, where he cannot even walk more than 50 meters. So this disease can affect anybody at any age. It does affect the older population more commonly because it takes time to damage these vessels. But if you, like this gentleman, if you start smoking at a very early age and you smoke 3 or 4 packs a day, after 20 or 15 years, you're going to have some damage to the arteries and have peripheral arterial disease.
Well, doctor, once again, we have to pause as we do need to take a break, but we'll be right back and we'll dive into more questions. Dear viewers, stay tuned. Let's watch this report together. We'll be right back. Stay tuned. Welcome back, dear viewers. And once again, we are joined in the studio with our distinguished guest, Dr. Abdullah Alfawaz. Now, Dr. Abdullah, we'll move on to the next subject, which is about prevention and healthy lifestyle. How can peripheral arterial disease be prevented?
So the major factors, or the most important factors that can prevent this disease, is by looking at the risk factors and trying to prevent them in the first place. So smoking and diabetes, we said they're the biggest risk factors, and preventing them will definitely decrease the risk of a patient developing peripheral arterial disease. The other risk factors are, cholesterol that's high, blood pressure that's high. So these other factors can be controlled as well if the patient has them with medications, and if the patient doesn't have them, with lifestyle choices, so they don't develop this disease in the first place. And then the other non-modifiable factors, well, we cannot do much about that.
Okay.
But if you know that you have a family history of this problem, then you should be more vigilant and try to, avoid these risk factors more than the normal person.
Now, you did touch upon the smoking aspect. How much of a role does it have if you quit smoking to reduce the effects of this disease?
So unfortunately, once the disease starts, it continues to progress. But we do know that if we stop smoking, the progression slows down significantly in these patients. So one of the first recommendations is to stop smoking before we even do any intervention or anything to fix these arteries, since even if we fix the arteries or put a stent, for example, the stent will not last that long if the patient continues to smoke, because the initial problem or the cause of the disease is still there.
What do you do with, let's say, patients that are somewhat stubborn and won't quit smoking?
Well, if the disease, usually what we do is, if the problem is not limb-threatening, so the patient is not at risk of losing their leg, then we don't jump into intervention, trying to fix the problem with surgery or with stent or with balloons. We kind of delay that as much as possible to give them a chance to change their mind, to stop smoking.
Lifestyle.
Yeah, fix the lifestyle that they have. And usually, most of the patients will find a way, whether it's nicotine patches, some medications, counseling, family support. All these can change the patient's mind, even if they're very stubborn.
Okay, so is controlling blood pressure and cholesterol enough to avoid the disease?
It's not enough, but it's definitely helpful. So the patients usually need every help they can get. So since we know that these factors play a significant role, even though it's not the biggest role, but they do play a significant role, and treatment is not very hard. So lifestyle can help with the blood pressure and the cholesterol, and some medications do help as well.
So when we talk about lifestyle, as you mentioned, the link between diet and artery health, what is the link between them?
So the link is indirect. So diet can lead to worsening of the risk factors we talked about.
Okay.
So a diet that's high in cholesterol will lead to increased cholesterol in the blood. A diet that's high in salt, for example, will lead to increased blood pressure. And then, a poor diet can also lead to diabetes as well, which also affects the blood vessels.
And how about the exercise? Of course, it helps improve flow.
Definitely. So one of the best ways to resolve adult onset diabetes is exercise, and especially resistance exercise. So it decreases what we call insulin resistance, one of the most common problems that we have in our community. So exercise helps fix the diabetic issue, the diabetes, and the blood sugars that are out of control, basically. So exercise does have a good impact on these patients.
Now, doctor, what kind of tips can you give to help diabetic patients protect their feet?
So we touched on this. So one thing is, there's stuff that they can do for the foot itself, and there's stuff for their general health. So for the general health, they need to make sure that the diabetes or the blood sugar is under control. So whether it's taking their medication, changing their lifestyle, visiting their doctor, listening to the recommendations. For the foot itself, I think daily inspections are very important, whether they do it or their family members do it. And then taking care of what they wear, basically. So first of all, they should not be walking barefoot. And second of all, the shoes they wear should be the appropriate fit and shape for the foot as well.
And can you elaborate more about, like, how do we check the feet daily to avoid these complications?
So the most important parts to be checked are the parts that the patients cannot see, and sometimes cannot reach. So between the toes and the the sole of the foot
Okay.
are the most important parts to make sure that there are no injuries, no cuts, no infections or anything like that.
And what is the role of health education and awareness in reducing the rates of this disease?
So, just like what we're trying to do here, trying to raise awareness about this issue. This issue is a big issue in our community.
Exactly.
In Kuwait, we have one of the highest rates of adult diabetes in the world. So it's between us and between the neighboring countries. So these patients with diabetes, a large percentage of them, about 20-25%, will develop diabetic foot problems at some point of their life. I think it's very important to raise awareness regarding this issue so that the patients know that they have this problem and act accordingly very early to prevent complications that cannot be fixed if they present very late.
I see. Well, Dr. Abdullah, we really enjoyed our talk today, but unfortunately, we have reached the end of this episode. Dr. Abdullah Alfawaz, Senior Specialist in Vascular Surgery and Catheterization, we thank you for your time and thank you for joining us.
Thank you. Thanks again.
Well, dear viewers, that concludes this episode of Doc Talks. We hope you enjoyed the journey just as much as we did. Make sure to join us again next time. Until then, stay safe and stay informed. Goodbye.